Hi guys, let's talk about inflammation. So this is something that's been a big buzzword because everyone is trying to get rid of their inflammation and they're trying to do anti-inflammatory things and anti-inflammatory diets. And the reason why is because inflammation doesn't feel very good. But let's just kind of talk about what it is in acute versus chronic and talk about sort of what you may be feeling if you're feeling this. So just to start out the very basics, if a trauma occurs, the immune system sends out repair cells. So this kind of trauma, like an acute trauma, can be smashing your finger, spraining your ankle, running your head into the wall, even eating foods that your body doesn't like or drinking alcohol can all be an immediate response to any type of trauma, if you will. Now, chronic inflammation is also what they call low-grade inflammation, and that's due to just continuous dysfunction day after day. So let's say, for example, we're sitting at a computer all day long. We have our head going super far forward, we have our shoulders rounded in, our ribs even brought forward, and our low back not sitting in a natural position. We do this every day, all day long, and we end up with something that's called chronic inflammation. Other body regions besides the ones that are just immediately affected can also start to be damaged, and that's due to overcompensation. So my body's really, really smart. So even whenever I stand up from that position, after I've been sitting 8 hours at my computer, or however long it may be, my body's still in that type of position. It will try to correct itself, and then other regions start to break down because they're really not meant to have that much pressure. Symptoms of this can be like stiffness, tenderness, aching, pain. Usually you hear somebody say, I'm really, really inflamed because it's swollen or it's hot or it's tender. Those are all cues for inflammation. Good Back Box actually addresses all of the root causes of this chronic inflammation that's going on by de-stressing that connective tissue, by retraining and strengthening muscle. And we really want to rebalance your body as a whole. So if you have any questions, comments, concerns, go ahead and send over a message. And if you want to know if you have chronic inflammation, you can go through and kind of think about the things that I said and assess your own body and see how you feel.